reporting. Now, over the years, we've been told many times that social care is on the brink of collapse. But today that warning comes from the most senior managers within the NHS. The heads of the NHS Confederation and NHS providers, along with the presidents and chairs of many of the Royal Colleges of Medicine, have written to the Prime Minister warning that 1 million older people are being denied help with basic tasks like getting out of bed or getting dressed or going to the loo. It's a situation they describe as a national disgrace, not least because the government promised to do something about it 2 years ago. The Chief Executive of the NHS Confederation, Niall Dickson, is here with me in the studio. Good afternoon to you. Now, you hear warnings often enough, you stop believing them. Is there something different now when you talk about collapse? What are you suggesting?
I think this is a cri de coeur from the whole of the health sector. And I suppose it would be fair to say that the NHS in the past has tended to look at its own performance, how it's doing, how it's being funded. I think there's an increasing recognition of the interdependence of different services, a lot of public services, but in particular social care, the sister service of the NHS. And the record, both in terms of funding and in terms of reform of social care, is really so abysmal, and it has got to a point where, and it's partly around austerity, so we saw an 11% cut in funding for social care up to 2016. These are services that have been pared back, and the people who are suffering are people who simply don't get eligible for support. So we know there's something like 1.5 million older people who are being denied that support. Now, the effect of that, first of all, you should get cross about that because of what is happening to those people. And obviously, secondly, it does wash on to other services. So the health service is seeing people turn up at accident and emergency who wouldn't turn up at accident and emergency if they'd been supported adequately back in the community. And likewise, there are patients, thousands of them, who are stuck in hospital beds because they can't get out because there aren't those services.
When we went to the Department for Health and Social Care this morning about this story, they came back to us with a statement saying we've provided local authorities with access to up to 3.6 billion more dedicated funding for adult social care this year, up to 3.9 billion for next year.
Well, they have started to put in a bit more money. The reality is that the gap between what is needed and even just keeping services running is still considerable. So the research that we commissioned from the Institute for Fiscal Studies, which is, as you know, an independent body in the Health Foundation, said it would need an additional 4% a year every year for the next 15 years. The fact is that at this moment there are negotiations going on within government about how to fund 2021, how are we going to keep this thing going. And I think there is real concern throughout the whole system that in spite of the rhetoric, in spite of the promises, government will not deliver on this.
OK, well, let's talk about that, because the promise was 2 years ago we will come up with a green paper, our proposals for how to create a long-term solution to funding social care. And that's what you're saying, come on, produce it.
We're certainly saying, come on, produce it, and maybe even saying, don't produce it if you're not going to produce anything, because I think that is one of the fears, is that they will not produce radical proposals, that instead they will not want to offend one bit of the public or another, and that therefore, or they don't have the money in order to be able to do it. So if we are going to see reform, let's see reform tackled. There are 4 things that they really need to tackle. The first is the workforce issue. There's a huge workforce problem, partly because we don't pay people enough and we don't value people enough in social care. Secondly, the funding levels, as we've discussed, in the immediate term are not providing the services that people need. Large numbers of people are not getting any kind of support whatsoever. Then there's the long-term funding issue, which again, government finds quite difficult to deal with. And again, it's not just this government, successive governments have stalled over this issue, said we're going to find a long-term solution in which, frankly, it's got to be a way in which we risk pool. We decide as a society how we're going to fund this stuff going forward. And the last point is probably one for the health service and social care, but also I think for government as well. How do we create a system in which we join up these services much more effectively at local level? Now, they need to tackle all those 4 things. I think there's a question mark over whether this green paper will do it. We can't prejudge it, but my goodness, it's taken them an awfully long time to produce it.
Well, the second part of the statement they sent to us says we will shortly set out our plans to reform the social care system for adults of all ages to ensure it is sustainable for the future. So we may well be seeing that, what they come up with shortly. Niall Dickson, Chief Executive of NHS Confederation, thank you very much. Well, the MP Sarah Wollaston is chair of the